Hello, in this episode, I'm going to talk to you about Beverly Allitt. Beverly was British. She was known as the Angel of Death. She was born in 1968. She was a nurse. Now, she killed a total of 4 people, and this event took place in 1991 in Lincolnshire, which is in the United Kingdom. I got some newspaper articles that I will read out to you. Then I will give you my own personal opinion on this case. If you do end up liking this video, please hit subscribe. Now, Beverly Allitt was a nurse, and she was suffering from the mental health illness known as Munchausen syndrome. And I'm pretty sure I butchered that name, but this is a desire to kill or injure others to get attention. So call it a little bit of sadism and a little bit of crazy. As a child, Allitt showed some worrying signs, including wearing bandages and plaster casts over wounds that she would then use to draw attention to herself, and she became increasingly attention-seeking in her behavior, often being aggressive towards others. She would spend a lot of time in hospitals seeking medical attention for a string of made-up ailments, which eventually culminated in the removal of her perfectly healthy appendix. This was slow to heal, as she would mess around with the surgical scar. She was also known to be an active self-harmer and had to resort to moving from doctor to doctor. As medical practitioners became familiar with her attention-seeking, Allitt's behavior as a teenager is now seen to be typical of Munchausen syndrome, and when this attention-seeking failed to get desired reactions in others, she began to harm others in order to satisfy her desire to be noticed. Allitt went on to train as a nurse at a local college. She was suspected of some odd behavior while at college, including smearing human feces on the walls in a nursing home where she did some on-the-job training. She wasn't always present during the training. She was absent quite a lot. They thought this was the case because of her illnesses. Despite her history of poor attendance and poor marks in her nursing exams, she was taken on a temporary 6-month contract at Grantham and Kesteven Hospital in Lincolnshire in 1991, where she began to work on Ward 4, the Children's Ward. Now, on the 21st of February 1991, Allitt's first victim, 7-month-old Liam Taylor, was admitted to the Children's Ward with a suspected chest infection. Allitt went out of her way to reassure his parents that he was in very capable hands, and persuaded them to go home and get some rest. When they came back to the ward some hours later, Allitt told them that Liam had suffered a respiratory emergency, but that he had recovered. She volunteered for extra night duty so she could watch over the boy, and his parents chose to spend the night at the hospital as well. Liam had another respiratory crisis just before midnight that same night, but it was felt that he'd come through it satisfactorily. Allitt was left alone with the boy. However, his condition worsened dramatically, becoming deathly pale before red blotches appeared on his face, at which point Allitt summoned an emergency resuscitation team. Staff were confused by the absence of alarm monitors at the time, which had failed to sound when he stopped breathing. Liam suffered cardiac arrest, and despite the best efforts of the attending team, he suffered severe brain damage and remained alive only with the help of a life support machine. On medical advice, his parents made the painful decision to remove their baby from life support, and his cause of death was recorded as heart failure. Allitt was never questioned about her role in Liam's death. So now we move on to the 5th of March 1991. Only 2 weeks after Liam's death, her next victim was Timothy Hardwick, an 11-year-old with cerebral palsy, who was admitted following an epileptic fit. Allitt took over his care, and again, following a period where she was alone with the boy, she summoned the emergency resuscitation team, who found him without a pulse and turning blue. Despite the best efforts of the team, which included a pediatric specialist, they were unable to revive Timothy. An autopsy later failed to provide an obvious cause of death, although his epilepsy was officially blamed. Now to the 8th of March 1991, Allitt's third victim, 1-year-old Kaylee Desmond, was admitted with a suspected chest infection, from which she seemed to be recovering well. 5 days later, with Allitt constantly by her side, Kaylee went into cardiac arrest in the same bed where Liam Taylor had died a fortnight before. The resuscitation team were able to revive her, and she was transferred to another hospital in Nottingham. where attending physicians discovered an odd puncture hole under her armpit during a thorough examination. They also discovered an air bubble near the puncture mark, which they attributed to an accidental injection, but there was no investigation. On the 20th of March 1991, 5-month-old Paul Crampton became Allitt's next victim. Admitted with a non-serious bronchial infection just prior to his discharge, Allitt summoned help as Paul appeared to be suffering from insulin shock, going into a near coma on 3 separate occasions. Each time the doctors revived him, but they were unable to explain the changing levels of his insulin. When he was transferred by ambulance to another hospital in Nottingham, Allitt went with him. He was again found to have too much insulin. On the 21st of March in 1991, which is the next day now, 5-year-old Bradley Gibson, a pneumonia sufferer, went into unexpected cardiac arrest but was saved by the resuscitation team. Subsequent blood tests showed that his insulin was high, which made no sense to the doctors. Attendance by Allitt resulted in another heart attack later that night, and he was transported to Nottingham, where he recovered. Despite this alarming increase in the incidence of unexplained health events, all in the presence of Allitt, no suspicions were aroused at this time. The 22nd of March 1991, a 2-year-old Yik Hong Chan turned blue and appeared in considerable distress when Allitt raised the alarm, but he responded well to oxygen. Another attack resulted in his transferal to the larger hospital in Nottingham, where he recovered. His symptoms were attributed to fractured skull as a result of a fall. Now, on the 1st of April 1991, twins Katie and Becky Phillips, just 2 months old, were kept in for observation as a result of their premature delivery. A bout of gastroenteritis brought Becky into Ward 4, where Nurse Allitt took over her care. 2 days later, Allitt raised the alarm, claiming that Becky appeared hypoglycemic and cold to the touch, but no ailment was found. Baby Becky was sent home with her mother. During the night, she went into convulsions and cried out in apparent pain, but when summoned, a doctor suggested she had simple colic. The parents kept her in their bed for observation, and she died during the night. Despite an autopsy, pathologists could find no clear cause of death. Becky's surviving twin, Katie, was admitted to Grantham Hospital as a precaution, and unfortunately for her, Allitt was again the nurse on duty. It wasn't long before Allitt was again summoning a resuscitation team to revive baby Katie, who had stopped breathing. Efforts to revive Katie were successful, but 2 days later she suffered a similar attack, which resulted in the collapse of her lungs. Following another revival effort, she was transferred to Nottingham, where it was found that 5 of her ribs were broken, in addition to having suffered serious brain damage as a result of her oxygen deprivation. 4 more victims followed, finally causing suspicions to be raised at the hospital. On the 22nd of April 1991, 15-month-old Claire Peck was brought onto Ward 4, an asthmatic who required a breathing tube. While in Allitt's care for only a few minutes, the infant suffered a heart attack. The resuscitation team revived her successfully, but when again alone in Allitt's presence, baby Claire suffered a second attack, from which she could not be revived. Although an autopsy indicated that Claire had died from natural causes, an inquiry was initiated by a consultant at the hospital, Dr. Nelson Porter, who was alarmed by the high number of cardiac arrests over the previous 2 months in the children's ward. An airborne virus was initially suspected, but nothing was found. A test that revealed a high level of potassium in baby Claire's blood resulted in the police being summoned 18 days later. Her exhumation discovered traces of the drug lignocrane, and this is a drug used during cardiac arrest, but it's never used on babies. The investigating police assigned to the case, Stuart Clifton, suspected foul play, and he examined the other suspicious cases that had occurred in the previous 2 months, finding very high doses of insulin in most. Further evidence revealed that Allitt had reported that the key to the insulating refrigerator was missing. All records were checked, parents of the victim were interviewed, and a security camera was installed. Suspicions were raised further when record checks revealed missing daily nursing logs, which corresponded to the time period where Paul Crampton had been in the ward. When 25 separate suspicious episodes with 13 victims were identified, 4 of whom were dead, the only common factor was the presence of nurse Beverly Allitt at every episode. On the 26th of July 1991, police felt that they had sufficient evidence to charge Allitt with murder, but it wasn't until November 1991 that she was formally charged. Allitt allegedly remained calm under interrogation, denying any part of the attacks, insisting she had merely been as a nurse caring for her patients. A search for her home revealed parts of the missing nursing log. Background checks by the police showed a pattern of behavior that pointed to a very serious personality disorder, and that Allitt may be exhibiting symptoms of both Munchausen syndrome and Munchausen syndrome by proxy, which are both characterized by getting attention through illness. With Munchausen syndrome, physical or psychological symptoms are either self-induced or feigned in oneself to gain attention, while Munchausen's by proxy involves inflicting injury on others to gain attention for oneself. November 1991, Allitt refused to confess what she had done. After a series of hearings, Allitt was charged with 4 counts of murder, 11 counts of attempted murder, and 11 counts of causing grievous bodily harm. As she awaited trial, she rapidly lost weight and developed anorexia nervosa, a further indication of her psychological problems. On the 15th of February 1993, after numerous delays due to various illnesses, she went to trial at Nottingham Crown Court, where the prosecutors demonstrated to the jury how she had been present at each suspicious episode, and the lack of episodes when she was taken off the ward suggested that she was guilty. Evidence about high readings of insulin and potassium in each of the victims, as well as drug injection and puncture marks, were also linked to Allitt. She was further accused of cutting off her victims' oxygen, either by smothering or by tampering with machines. On February 28, 1993, Allitt was given 13 life sentences at Nottingham Crown Court after being convicted of murdering 4 children and attacking 9 others. Her arrest followed an investigation into several incidents of alleged tampering with patients' ventilators and pumps, delivering intravenous medication at various hospitals in Lincolnshire and Nottinghamshire. The killer nurse is now detained in Rampton Maximum Security Hospital for the criminally insane. It is unlikely that she will ever get out, but if she does, relatives of the dead children have promised to kill her. Public reaction to the case was particularly hostile, as, being a nurse, she was obviously in a position of trust and in charge of caring for children. Although no further investigations are ongoing, it is not known if Allitt had killed more of her patients in the past. It has been reported that Allitt carried on her attention-seeking behavior in Rampton, ingesting ground glass and pouring boiling water on her hand. Right, so now we come to my thoughts in conclusion. I couldn't find too many or much information on her childhood, but I think perhaps her parents at some point abandoned her, or they didn't give her the attention she wanted. When a child is going through the ages of, from when they're born to, like, say, 4 years old, that's critical in the child trying to understand who's going to provide their needs for them, right? Like, when a child runs to their father, it's because he knows that's the person that's going to protect him, right? Through experience and having a relationship with the father or the mother. I don't think Beverly ever had that with any of her parents. And I think she took that, or that void of attention, that void of being at the center of her parents' life or whoever it may be, she took it into her adult life. And I think the reason why she picked on children is out of spite. She looked at these children, she saw how the parents cared for them, allegedly, right? And she thought, well, I never got that. Nobody ever cared for me, so I'm going to take it away from them. She's obviously seeking attention because she didn't get it elsewhere. I'm not justifying her behavior. It's disgusting what she did. It's insane what she did. But to understand the way she was raised and why she killed to seek attention will give you further context on why this happened. Either way, she should never be released from prison, and it's cases like these where you do wonder, like, how do these people get in a position of being a nurse? It's a position of trust, right? As I mentioned earlier. Anyway, that's that story. It's insane. I can't imagine how the parents feel. They'll never get over it. Maybe they've gotten used to it, but they'll never get over it. I do understand from what I read, one of the parents was awarded 2.2 million or something like that in compensation, which doesn't do anything. There's no price on your kids, but maybe even for a split second, if she felt better, fair enough. Anyway, thank you for listening.